OET Listening. The listening subtest consists of 3 parts. The topics are of generic healthcare interest and are accessible to candidates across all professions. It is designed to assess a range of listening skills, such as identifying specific information, detail, gist, opinion, or the speaker's purpose. Let's start with the course objectives. By the end of this lesson, you will learn all about the format of listening Part A, Part B, and Part C. You will also understand the different settings and how to identify headings, subheadings, titles, and subtitles, as well as different keywords from your notes. The last skill that you will learn is the skill of prediction. On the listening subtest, you will have 42 question items. They will be generic healthcare topics, and the test will run for a total of 40 minutes. You will hear each recording once only, and you are asked to write your answers while listening. In each part of the listening subtest, you will hear a number of different extracts. At the end of each extract, you will hear a beep sound. You will be given time to read your questions before each extract. How much time will be given to you will be mentioned in the recording. At the end of the test, you will have 2 minutes to check your answers. Remember that in listening, wrong spelling can be right, so do focus on the sound and not the spelling of the word that you hear. The instructions that you will hear will be like this.
Occupational English Test. Sample Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers.
The listening subtest format. In Part A, you will hear 2 different consultations, where a healthcare professional is talking to a patient. This is a note completion task with 12 questions per recording. You will hear 2 voices, 1 male and 1 female. Remember that on Part A, most of your answers will come from the patient, and the medical professional will help with signposting. In Part B, you will hear 6 different extracts. In each recording, you will hear healthcare professionals either talking to each other or to a patient. This is a multiple choice question task with 1 question per recording. Again, there will be 2 voices, 1 male and 1 female. In Part C, you hear 2 longer recordings, either an interview or a presentation on a topic related to healthcare. Same as Part B, this is a multiple choice question task. There will be 6 questions per recording, and during an interview, there will be again 2 voices, 1 male and 1 female. On the presentation, there will only be 1 speaker, so do listen very well. On Part A, this is what you do on a daily basis in your medical life. You talk to patients. You listen for details. Part A tests your ability to understand and record information about your patients, such as medical history, symptoms, medications, treatments, and others. How well you listen to your patients will be tested in Part A. In here, the medical professional hardly speaks. The patient does most of the talking. Part B is typically your conversations with the people you work with. How well do you listen to them? This can also be conversations with your patients, but in here, the medical professional speaks more. Part C are recordings of presentations that you might have heard as a medical student, as a trainee, or as part of your continued development. These recordings also cover interviews typical of specialists who presents their research and findings or gives instructions or information about a certain medical topic. The listening subtest assessment. On Part A, this is worth 24 points. Hence, a very important part of your grade B relies on you mastering this part of the test. Part B is worth 6 points. 6 recordings with 1 question each. Together with Part A, this constitutes 30 points, the score that you need on average to get a grade B. Part C is 12 points, and this is the hardest part of the exam. If you focus your skill on Part A and B, which are the 2 easiest parts of the test, then any scores on Part C will always be a bonus. This is all about you, how well you listen to your patients, how well you listen to your colleagues or your coworkers, how well you listen to presentations, and how well you listen to interviews. The total score possible for listening subtests is 42 points. Your answers for Part A are double marked, and they will be done by 2 trained OET assessors. These answers are randomly assigned to assessors to avoid any conflict of interest. Your answers for Parts B and C are computer scanned and are automatically scored. Let's have a look at some of your questions. What are the accents on the listening subtest? The main accents are Australian, British, and American. There will also be other accents such as Canadian, Irish, and other neutral accents as well. Where should you write your answers? For Part A, you must write your answers in the space provided in the question booklet. For Parts B and C, you must shade the lozenge next to the appropriate answer. Answers written elsewhere in your booklet will not be marked. Do you have time to check your answers? Yes, you will. You will have 2 minutes at the end of the subtest to check your answers for all 3 parts of the listening exam. You will listen to each part of the test once only, so ensure that you are writing your answers in the question booklet as you listen. Will you lose marks on spelling mistakes? In the listening subtest, you will not be penalized for misspelling, provided that the meaning is clear to other healthcare professionals. Any reasonable attempt at spelling the correct answer has a good chance of being accepted. Will you lose marks for extra words in your answers? There's actually no penalty for including information that is not in the marking guide. However, you will lose marks if you contradict yourself or if you make your meaning unclear. How many correct answers do you need for a grade B? The number of marks needed to secure grade B varies. However, test takers awarded grade B will typically have a score of at least 30 marks or 30 points. In your practice tests, aim for a score over 32 consistently. Let's begin.